male and female reproductive health. We're going to be having special focus on reproductive health. Reproductive health is simply health of your reproductive system, meaning the system that produces babies, that reproduces, forms human beings for both men and women. That's what we're going to be focusing on. There are a lot of problems that affect that system, that causes some women to have infertility, that causes some men not to be able to get women pregnant. Now we're going to be diving deep into all of those little problems that can affect the male and the female reproductive system that can cause problems. Now let's just have a brief overview of the male and female reproductive system, right? Now the male reproductive system, as you can see, is made up of the things you can see externally, the penis, which all of us know, the testes, those two balls that are dangling down there. Inside the penis, you have a tube called the urethra. That tube goes directly up into what we call the bladder, where urine is stored. So that's why urine passes through that tube. But you also have something that passes there, which is called semen. Semen contains sperm. Sperm is produced in the testes. There's a tube that leaves the testes and meets into the urethra. That tube is called the vas deferens. That's the tube that carries sperm. And then at a certain point there, it's mixed with other fluids and to produce semen, which is what you ejaculate outside. Actually, that fluid is actually called semen, not sperm. Sperm is part of it. It's just a component of it. Anyways, we'll not go to the detail of how it's formed, the glands, you understand. It's not a biology lesson. For the female reproductive system, entering inside, you get to the vagina, right? Climbing up, you meet a junction called the cervix. That cervix leads you into the uterus, or the womb, as it's locally called. The womb is connected to two tubes. Those two tubes are called the fallopian tubes. There are two of them, and at the end of them you can find what you call the ovaries. The ovaries are responsible for production of the egg. Each ovary produces one egg at a time. They move into the fallopian tube and they stay there. That's where fertilization takes place. During sexual intercourse, the man releases about 3 million plus sperms, and they are rushing. Who will meet the ovum fertilized first? They are making a run. Who will reach first? They are run. One successfully reaches there, fertilizes the egg, and then we have the result, which is somebody like me. It's as a result of that process. So that's a simple explanation of everything that happens. There is more detail than that. It is much more detailed than that. There are hormones involved. There are glands involved. So I don't want to go into all of those details. No, that is what happens on a normal male and female reproductive system when they meet. But if things are wrong, a lot of things don't happen. That's why we'll be focusing now. What is the problem? What causes things to go wrong? What causes things to go wrong? Why is it that in some people it's difficult? It's not as easy as in others. What are the problems that affect each of those things? What are the things we do that puts us at risk? What are we supposed to do to prevent us from falling into things like infertility, having spontaneous miscarriages? What do we do? So I guarantee you to stay tuned to Isham Health Tips. Glue to your phone, because every week, Facebook and on YouTube, videos are going to be landing on both platforms simultaneously Sundays every week. Thank you very much. See you on Sunday.